we have worked to improve hygiene in very poor communities, combining health literacy, microbiology, public health science, as well as, we believe it demonstrated a very successful public-private partnership by using both the strengths of Clorox and the strengths of Canyon Ranch Institute. Clorox Company was founded in 1913, so we are approaching our 100th birthday. We started making and selling Clorox liquid bleach. Today, we sell about $5.5 billion of products, and it's a very broad range of products over 100 countries.
Good morning again, I'm Jennifer King, and like Suzanne, I'm very pleased to be here to tell you about this health literacy program. Canyon Ranch Institute, especially as compared with the Clorox Company, is small. We have a global reach because of our partnership model. In every one of our partners, and we have 14, we have collaborators who those partners bring in, as well as many of them, especially in the case of the Clorox Company, involve their employees. And so it's through this integrative approach to advancing health literacy that we're able to address what many people see as extremely challenging problems in public health, even some described as intractable problems. And we are able to do this not only through the partnerships, but by looking even beyond the causes of the problems to the causes of the causes. And that's what we'll be talking about a bit today. It's true that Clorox is a for-profit company. Canyon Ranch Institute is a non-profit public charity, but our fundamental guiding principles, and this is what our board member recognized, our missions, our visions, our values are very complementary. We're both interested in improving lives. So you see the Clorox mission of we make everyday life better every day. And then the Canyon Ranch Institute, the power and possibility of a healthy world. Both organizations have the values of working well with others, in other words, partnership, and are very principled in all of our approaches. This made for an extraordinarily good fit.
So why this program? First and foremost, improving health is a priority for both companies and the nonprofit. Clorox, with Clorox liquid bleach, has a strong disinfecting heritage. Clorox liquid bleach has improved health and hygiene of people all over the world, both in water disinfection and hard surface disinfection. And we have a number of programs where we're working on educating people on how to improve their health, themselves and their families through hygiene and disinfecting products. Canyon Ranch Institute, with their strong health literacy focus and their great skill at educating people, really made a great fit for what we wanted to try to do. And this program is perfect for the two groups because it does focus on hygiene and health, and it does focus on health literacy. So it was a perfect place to start our partnership. How did we partner? And some of these are some key learnings that we've had in our partnering. One enabler is to, up front, make it very clear who's doing what. So we figured out who at Clorox had the right skills, who at Canyon Ranch Institute had the right skills, and clearly outline what their roles and responsibilities would be. Second, we had an ongoing communication and collaboration. The working team had regular conference calls and occasional face-to-face meetings. And Jennifer and I talked regularly to make sure that we were giving consistent direction and messages for the people on both sides. Most importantly, we leveraged the strengths of both organizations. Clorox provided the funding and the microbiology, public health science expertise. We were in Peru, not by accident. Clorox has a very strong business in Peru, and we could leverage both our product distribution and business experience there. And then finally, we identified University of Arizona, specifically Dr. Kelly Reynolds, as a great partner for doing the microbiology research. Canyon Ranch Institute brought overall program leadership, very strong expertise in the social sciences and health literacy. And they identified Boston University College of Arts, specifically Dr. Andre Quadros, as a great arts partner, as well as the local Peruvian arts and social science partners. Now this program, we call it Arts for the Behavior Change. is using the arts to help promote understanding of what people need to change to get better personal and household hygiene, as well as how to use different products and disinfecting products. Importantly, this was an unbranded program, so this was not Clorox coming in and promoting Clorox products. This was talking more neutrally, letting the community learn and understand and be empowered to pick what products they thought were best for them and their families.
In terms of key outcomes, this is something that was a major focus of the work that we all did together with the collaborators Suzanne just mentioned, was that we were driving toward having measurable outcomes. And one of the areas in which we greatly exceeded our expectations for what we set as our prospective goals was attendance by the community members and participation in the 12 performances that we'll tell you about in just a moment. We measured knowledge and understanding. There was increased uptake of both, and also changes in actual behaviors. In addition, we'll tell you a bit about the improvements in the microbiological burden in those areas that were targeted for the communities that were selected. As Suzanne mentioned, Clorox has a strong business in Peru, and the decision was made that we would work in these shanty towns, which is not a pejorative, that's the term they themselves use in describing the communities. In November of 2010, a team from Candy Ranch Institute, Boston University, and the Clorox Company went and did site visits at numerous communities, numerous shanty towns around Lima. And as you can see from this slide, there is tremendous need in the communities. That's an actual image from one of the communities that we did work in eventually. We developed together, among all of the collaborators, a set of criteria for selecting the communities we would eventually work in. It was not only a formative assessment and a pre-post design that was conducted through interviews and observation. There was also a process evaluation throughout the 12 performances over 11 weeks, and the performances were a telenovela style. The microbiological work was done formative as well as pre and post, and there's a whole lot more detail, of course, that went on in the program, including workshops and ways that we promoted the performances to get the high level of engagement and attendance. We would love to answer questions about that. Time simply doesn't allow today, but you'll have our emails and you're more than welcome to contact us. One of the most interesting aspects of this arts program that used health literacy to improve household hygiene was that we had the opportunity to work with a community of people, in particular the arts community, actors and singers and puppeteers and dancers, who had the opportunity over a 2-week workshop in Lima to learn about germ theory. And microbiologists from the Clorox Company, from the University of Arizona, came in and taught everybody about microbiology. And during that time as well, the health literacy aspect of what is it and how do we use it and how is it different from what you may have seen of handing out brochures in neighborhoods. And that was Dr. Andrew Pleasant, who led the health literacy training for our arts partners. We also, during these 2 weeks, outlined the first 4 episodes of the telenovela. However, there was constant change in all of the episodes because of the interaction of the community, which you can see here a bit. The key thing that we really do want to emphasize when talking about doing this type of partnership is that it was so important for us to really engage and honor the existing leadership structures in the communities where we were so privileged to work. That was really critical. There were a lot of lessons that we learned along the way. One that we've got some fascinating data about is when we didn't engage as much with the community leaders, the structure there, we did not have as much success. So the performances, just briefly I'll tell you that the play was called Siempre, which translates in English to always, as in always sick. And there were two families that made up all of the characters the actors portrayed on the stage, the Maranas and the Buendias. The Maranas means sort of maybe disorganized or even messy. Buendias means the good days. And each family, however, had some of the opposite characteristics in them too. So this is the sort of tension that helped to drive along the narrative. And throughout all of the 12 performances, the community was extremely engaged, coming up on stage, asking questions, even replacing the actors up on stage if they wanted to say, here's how I really think something should go. For example, around about episode 7, I believe, one of the beloved characters died. It was a little girl who died, and the community did not like that. And so the joker, the facilitator, who's a physician, Dr. Jose Vignoles, also a community health expert, stood up and said, all right, so you know enough now, maybe we could have prevented the death of this child. How would that occur? And then the community stood up and explained how that could have happened. And the little girl was brought back, which meant a lot of rewriting for the writing team, but that was okay because that showed the engagement that was really occurring.
Where the behavioral outcomes were very strong, and the microbiological outcomes were more mixed. And that is the overall microbiological load was very high, both before and after performances. This is largely due to the high poverty level of this community and the openness, so it was very hard to control any given area. This picture shows part of the problem. That is a bathroom in the community. So it's very hard to control any of the microbiology as a result of that. The second big learning we had in this was that the microbiology team needed to be much more closely linked to what the performance messages were to make sure that we were testing before and after the same areas that the performances were highlighting. Even given all of this, we did get some positive improvement in the overall decrease of E. coli and Listeria. The biggest improvement was in food preparation areas, which was one very large topic in the performances, where we did see less samples, almost a third less samples that had any E. coli or Listeria in there. So this does show that there was some change. In future work in this area, we do plan on adjusting exactly how we do the microbiology. So in conclusion, this pilot did demonstrate the effectiveness of this approach of the community engagement and using performing arts to advance health literacy and improve health-related behaviors. We've also demonstrated the power of the public-private partnership. And one of the things that we believe makes this partnership particularly powerful was it's not just Clorox funding a nonprofit and then going to do work. It's both groups bringing in the best people that they had to be able to collaborate to come up with a really unique and effective program. We believe that this is a very good way to improve public health, and it would be a great add to many different communities and cultures. So our next steps is we are looking right now as to where and how to best scale this program, trying to expand finding additional funding, and making sure that people understand what we've done and what we've learned so that we can continue to go after these very tough, perhaps intractable, but we believe that we can make a difference if we all keep taking part in this area. And I'll leave you with a quote from one of our community participants. We're so lucky to have this program in our community, so everyone should come. Thank you.